All right, everybody, back with a brand new Cabral Concept. If you've been suffering from migraines or headaches, or you know someone, a loved one, a family member, or a client in your practice, today's podcast, I think, will be helpful in terms of two of the factors that we look at in overall holistic or natural health. So when we look at what could be the issue, we're oftentimes looking at deficiencies or toxicities. So the way that we've been able to help so many people, hundreds of thousands of people in our practice over the past 20 plus years, is by assessing, okay, what's going on with this individual? What could their deficiencies be? Vitamins, minerals? Could it be omega-3s? Could it be other nutrients that the body needs? Proteins, amino acids, carbohydrates, fatty acids, etc. Or might it be toxicities? Maybe it's gut health. Maybe it's parasites or H. pylori or candida overgrowth like yeast. Maybe it's bacterial overgrowth like SIBO. Maybe it's mold. Maybe it's viruses. Maybe it's Lyme. Maybe it's like all of these toxicities, right? So what our job is to assess, what does someone have too little of, deficiencies? What do they have too much of, toxicities, and help them rebalance their body? And that's why we've been very successful. We've now taught this for the past, essentially, over a decade to practitioners, but officially about 6 years now through the Integrative Health Practitioner Institute. So what I want to focus on today, though, are very specific deficiencies for studies for migraines and headaches. Now, maybe this is something you're suffering from, maybe not. But the studies are in, this is newer research, and they've confirmed at least that I would start with this, like bottom line, I would at least start here before you even maybe dig deeper. Now, I will be honest though, the way we're able to help people in our practice with migraines, tension, headaches, etc., is by looking at what are all their vitamin, mineral, omegas, et cetera, deficiencies and toxicities. So I'd be remiss if I didn't say this. You can run it with any integrative health practitioner level 2. You can run it with most naturopathic doctors. So it's your choice, right? So what we run though is at stephencabral.com/big5. Anybody can run that. You're welcome to. It doesn't have to be with Equalife, but that's what we use. So I just want you to know that's how we help people. Then we get deeper. Could it be histamine issues? Could it be food sensitivities? Could it be postural-based, biomechanical issues? Could it be stress-based? Could it be an imbalance in hormones? I've shared this before, but if estrogen levels start to rise, that can increase histamines then. So is it histamines or is it high levels of estrogen? Well, again, you always continue to look at the root cause. So we rebalance that. So there are many factors for migraines and headaches. I don't want to say that these 4 specific studies are the end all be all, but they were clearly very helpful. And so that's what I wanted to share with them right now. If you want a more personalized approach, then look at the big 5, okay? All right, so study number 1. This was interesting. I'm going to read them to you. I'm going to summarize them. You can do with it as you wish. I'll even give you, though, like the direct action takeaways. All right, study number 1, both the frequency and duration of migraine episodes were significantly lower in a melatonin group compared to a placebo in the second and third 4 months of follow-up. So this is a big deal. So this is 3 to 4 months later, the results were in. So let's go over it. In addition, both the MIDAS and PSQI scores were significantly improved in the melatonin group at the 2-month and 4-month follow-ups compared to placebo. All right. So I always look for studies where there's a placebo run and that the control group, whatever they're controlling for, or they're looking at dose dependent, outperforms the placebo. Because if whatever they gave these individuals, the placebo got the same group, we need to throw that out. It's not like the placebo group doesn't work, but it doesn't do any better than the placebo. Okay, so here we go. Most patients who experienced episodic migraines have concurrent sleep disturbances as well, because melatonin is both a hypothalamic neuropeptide and plays a role in circadian rhythms. It has been considered a potential intervention. So 60 patients, mean age was 33, 25 men, 35 women, experienced chronic migraines based on the ICHD. I won't give you all the different scores that they've taken, but they completed this randomized double-blind control study, and they took 3 milligrams of melatonin 1 hour before bedtime for 2 months, and then they had their follow-ups. Well, it showed that just 3 milligrams of melatonin 1 hour before bed significantly decreased the overall pain and frequency of the migraines and headaches. So pretty fantastic there. And 3 milligrams is a small dosage of melatonin. All right, next up, study number 2. Randomized, double-blind, placebo-controlled trial, 70 participants, ages 20 to 65 years old. with a diagnosis of episodic migraines, 15 migraine days per month with at least 1 year. So basically around 15 times per month, half the days per month or less. And at least it's been going on for at least 1 year. All right. So they either got fish oil or a placebo for 12 weeks. The fish oil contained 900 milligrams of EPA. So not even a high dosage. It was 1 gram of fish oil. Okay. Let's see. There was 100% adherence rate to the fish oil used during the study. Compared at baseline at 12 weeks, the EPA, which is again, is just a type of fish oil, I'll explain that in just a moment, showed significant improvements in migraine frequency. They cut them by more than half. So the average migraines per month was 7.4 in this group of 70 people. And now again, it's not a huge group. I get it. Larger groups can be run, but it went down to 3. So from 7.4 to 3 days per month. That's anybody who's dealing with migraines and it's 7 to 8, so more than a week a month of migraines, down to 3 days, 10% of the month, they would gladly trade that, that's for sure. All right, so what went down? Acute headache, medication, headache severity, et cetera, et cetera. Pretty impressive for 1 gram of fish oil. So in our practice, we use 2.5 to 5 milligrams of melatonin. And for fish oil, we also use the high EPA, which continues to be shown now year after year to be better than just DHA, right? So for the longest time in the early 2000s, everybody was doing DHA. We noticed based on lab testing that EPA was the greater of the two because it can be converted to DHA. Ours is a 2.5 to 1 ratio of EPA to DHA. That's the sweet spot. Again, you don't have to take my word for it. Part of the big 5 labs is the inflammation test, and you'll actually get to see your omega-6 to omega-3 levels. All right, so we recommend 2 grams. This study was 1 gram. 2 grams seems to be the sweet spot for most people based on previous research as well. All right, that was study number 2. Study number 3 was an all-encompassing study. It was malnutrition was present in 43.3% of migraine patients, which is a wild statistic. So what they did was because of the low percentage basically of malnutrition on a certain score, the data was divided into further what are called tertiles for a more in-depth view, which showed a higher proportion of migraine patients in the most severe malnutrition tertile. So what it means is this, is that looking at people on a malnutrition score, basically, what are they getting for their vitamins and minerals, their nutrients on a daily basis? Well, there was a absolute outlier for people with the most severe malnutrition and migraines. So in the middle, everything looks like fairly normal. And then when you look at, though, out of the people who have severe malnutrition, they had some of the highest rate of migraines. And it didn't give a reason why, right? But we just went into it a little bit. Well, if your hormones are imbalanced, your gut health's imbalanced, you don't have enough omega-3s, we'll say, well, it's leading then to potentially more migraines. So I found that really fascinating. I think it's really difficult to produce the proper amount of neurotransmitters in your body and hormones when you're severely, I don't want to say malnourished. I think it's the wrong word. Your micronutrients can be lower than they should be. It's an important way of looking at it. All right. The last study, which also reinforces the previous study I just mentioned, is on selenium, specifically looking at oxidative stress. So oxidative stress has been identified as a contributing factor to migraines. A double-blind, placebo-controlled trial examined the effect of antioxidant mineral selenium on migraine sufferers. 72 people were in the study, 36 in placebo, 36 in the selenium group. They were randomly assigned, and they were given 200 micrograms of selenium each day for 12 weeks. Selenomethionine, if you're looking at the type of selenium. And then they looked at the markers of oxidative stress. They also looked at nitric oxide. They looked at antioxidant capacity, total oxidant status, clinical migraine characteristics. They looked at mental health status, anxiety, depression, distress, quality of 2 scales for headaches and migraines, headache impact test, as well as the migraine specific quality of life. That's that MSQ we talked about before, were assessed at the baseline. So results with significant statistical analysis. Here is selenium versus the placebo. So those who were given 200 micrograms of selenium reduced nitric oxide, which could be a factor in increased migraines. Now, some people want to increase NO for cardiovascular, for exercise, for different reasons, but it can lead to migraines in some individuals. Increased total antioxidant capacity, protection against the MDA production, which is markers of oxidative stress, and yes, reduced migraine frequency, so less migraines per month, less migraine intensity, so when someone got a migraine, it wasn't as strong, and then a lower score on the headache impact test. Well, how much does the headache impact your life, essentially? So that's pretty impressive from, again, 200 micrograms of selenium. Now, I don't really believe that anybody should just take a selenium nutritional supplement. I really don't think it's necessary, because you're going to get 200 micrograms of selenium, well, at least 100 in a daily activated multi, a daily nutritional support, a lot of people using thyroid supplements that has selenium. So very infrequently will you need a specific selenium product. It's in most of your products. But the problem is, like we saw before, a lot of malnutrition or malnutrient absorption in many, many people. So right here, we just saw what could work. Well, omega-3s could work, specifically EPA. Melatonin could work, 3 milligrams. Selenium could work, 200 micrograms a day. I've given other studies that showed magnesium can be helpful. So there are lots of different factors, but really, what are we looking at? Well, a lot of people, again in study number 3, are missing vital nutrients in their body. Vitamins, minerals, and omega-3s specifically in this case, as well as other factors which we could call hormonal in nature, vitamin D and melatonin, because they have an effect on so many other factors in the body like hormones. So if you want a personalized protocol, I recommend the Big 5. That's StephenCabral.com/Big5, or even just the vitamin tox test, which is 2 of those 5. You can run it at Equilife. You can run it with an Integrative Health Practitioner Level 2. If you don't want to run any labs, but you just want all the nutrition that we're talking about, it's called the Daily Foundational Protocol Level 2. So DFP Level 2. And you can find all of these things at StephenCabral.com/shop. If you want to purchase it from your functional medicine doctor or integrative health practitioner, phenomenal. But at least see how you get all the nutrients in a day besides your good, healthy food. I'm not saying don't eat good, healthy food. That's the foundation, right? So you should absolutely eat good, quality, healthy food. But then these nutritional supplements, they do work. They honestly do. You don't want to overdo it. When it says 3 milligrams of melatonin, they didn't say 30. They said 3 milligrams, right? We recommend 2.5 to 5 milligrams for many individuals. Does everybody need it? No. If you're sleeping soundly, you're doing great. You don't have the acid reflux that melatonin can be great for, the deep sleep, the REM sleep, the viral-based issues, the headaches, all these different things, then you may not need it. That's why these things can be personalized. So I'm going to keep it there for today. If you'd like to see the studies, Thorne gave a really nice summary on these, but I'm going to link up the actual clinical research studies at StephenCabral.com/3091, StephenCabral.com/3091. I will link up all 4 studies. I can't link up nutritional supplements, but I can link up the labs and those studies. So one more time, StephenCabral.com/3091 for all the takeaways and those links. If the show is helpful, do feel free to pass it along to anyone you feel it could serve. Take care, everybody. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.